Hello, my name is Leslie Cordial, and today I'm going to present my project to you, which is my take on how to increase compliance of the daily chlorhexidine application through the use of a behavioral contract in the prevention of central line associated bloodstream infections or CLABSI. The clinical nursing problem is compliance and maintenance of central line catheters outside of the ICU setting in the prevention of CLABSI. This is significant because most literature examined on CLABSI reduction is focused within the ICU areas. However, 70% of central lines are located outside of the ICU. The spread of successful practices to other hospital areas or even the outpatient areas remains a major challenge. This suggests disparities in the adoption, compliance, and sustainment of the already recommended protocols that are in place. For the purpose of this project, hospital-acquired infections will be the focus, but most specifically CLABSI, and how the daily application of chlorhexidine has been shown to decrease the incidence of hospital-acquired infection rates. So the review of the literature for this project focused on the adult population, chlorhexidine application, health promotion, and patient-centeredness. Each study prompted the staff to become familiar with and to increase compliance with standard protocols that in recent years has become an accepted practices for many medical facilities. The value for nursing practice is to increase the focus of the prevention of central line infections. Suggestions with additional education among both groups should be completed and communicated with the importance of these practices. A sound knowledge base and a complete understanding of these practices will most likely contribute towards compliance among nurses and therefore improve practice. In addition to increasing compliance among the staff and patients, these studies demonstrated the effectiveness of a cohesive partnership. So my proposed project is to establish a behavioral contract between the staff and the patients or families that will provide or promote partnership in the care of the central lines. These patients and families will be educated on hospital-acquired infections, CLABSI, and the rationale for the importance of applying chlorhexidine on a daily basis. So the method of my project is to develop and implement a evidence-based behavioral contract in the acute care setting with the independent adult populations. So my plan is to assemble an interdisciplinary team with a principal investigator, a clinical nurse specialist, 2 staff RNs, and 2 nursing care technicians. I also want to develop a partnership with the infection control preventionist and the PICLINE team. They're all located within UK Medical Center, and I plan to implement my project on 3 North, who currently has a very high incidence of central line catheters, but as well as a very large population of independent adult patients. For introducing the behavioral contract within this population and the staff, this will hopefully hold the staff accountable when the task has not been completed, such as the application of chlorhexidine on a daily basis. The behavioral contract is anticipated to decrease confusion of who will be applying the chlorhexidine, increase the compliance and documentation of the task, and therefore decrease infection rates within this population. The outcome of this project is going to be measured by comparing documentation, compliance rates before and after the implementation of the project. The goal is to increase compliance rates by 50% within 4 weeks of implementation. The outcome will be measured using a paired t-test. This test is appropriate for data in which 2 samples are paired in the same way. The pair for this project consists of before and after measurements of the intervention.